Uterine fibroids depend on estrogen and progesterone to grow, and therefore are only relevant during the childbearing or reproductive years. Uterine fibroids decrease in size or calcify after menopause due to a decrease in hormone production. A woman can have one uterine fibroid or multiple fibroids.
And welcome back to another edition of Health Talk. According to the National Institute of Health, about 70 to 80% of women will have experienced fibroids by the age of 50. Some women may not even be aware that they have them because they often do not cause any pain or symptoms for that matter. For about less than 25% of women will experience symptoms that range from minor pain, occasional irregular bleeding, sometimes to a point where it is so severe they may require surgery. Now, the subject of our discussion today is uterine fibroids. And to help us understand the subject in a lot more detail, we put together a panel list of experienced specialists. A physician assistant, graduate from the Mother Patin College of Health Sciences with a bachelor degree in biology, a final year student at the A.M. Dougherty College of Medicine. Next to him is another physician assistant from the St. Joseph Catholic Hospital and a final year student at the Mother Patin College of Health Sciences. You can also be part of the show by sharing your experience with us or simply asking our guests some questions on uterine fibroid. The numbers to call is 0770-107-107, 0886-107-107. You can also subscribe to our YouTube channel, Mama Lume Health Talk platform, or simply interact with us on our Facebook page, Mama Lume Health Talk platform. Continue to follow our Facebook for more detail on your health. So sit back, relax, and learn from this exciting health talk coming to you just after a short break. I am Mama Lume, and this is her.
Uterine fibroids are benign growths of the uterus that often appear during the reproductive years. Also called uterine leiomyoma, uterine fibroids depend on estrogen and progesterone to grow, and therefore are only relevant during the childbearing or reproductive years. Uterine fibroids decrease in size or calcify after menopause due to a decrease in hormone production.
So much, Mama.
And next to him is a final year student from the A.M. Dougherty College of Medicine, Mr. Amos T.P. Mr. P, welcome to Health Talk.
Thank you very much.
Okay, let's start with the basic, Mr. P. Time is actually not in our favor. It's sorry for us starting little bit late, but again, it is what it is. So let's start with you, Mr. P. Today we are talking about uterine fibroids, right? And for the benefit of the audience and for the benefit of our viewers and our listeners, I would like you to tell us what are fibroids.
Earl, how are you? Before I start, I'm happy to be part of this discussion. Uterine fibroids is actually a non-cancerous growth in and around the uterus. The key word is non-cancerous. If you take into consideration growth have two patterns. The first pattern have to do with you have a abnormal growth taking place in a specific cell, and it is restricted, meaning that it's not disseminated. That's one aspect of it. Another aspect will be wherein the growth is taking, it had an origin and it spread to other part of the cells. That's another area. So we had two different types of growth pattern. So one we call one as the first one that we discussed, where it is disseminated, we refer to as cancerous. We refer to it as malignant. We refer to it as bad growth. On our discussion today, uterine fibroid being a non-cancerous growth. You can call it a benign growth, or you can call it a good growth. I know it will be so much oxymoronic to say
When you
good
say
and
non-cancerous in your explanation, can you please make it a little bit understanding for the audience?
when we say non-cancerous, we are talking about a growth pattern that remain confined only to the structure that has been affected, meaning that it's not sparing to other, let's say, distal or proximal structure. So that's how uterus fibroid is like. So it's not confined within the uterus and its structure and its neighboring structure, actually.
Thank you so much. Thank you so much. So let us move to Mr. King. Mr. King, today we are discussing uterine fibroids. How common are these uterine fibroids? How common are fibroids in?
So it is that common, but most people don't notice it because in the early stage, it's always asymptomatic. That is, there is no symptom at all. So you think you don't have it, but the truth of the matter, it is there. So the only time most people get to notice it, except when they start experiencing those signs and symptoms that lead to complication before they get to the disease. But it's something that is actually really common. According to research, some will tell you say 80% in black women, some will tell you 70% in black women. So it's something that is really common.
Okay. So it's really common among the black women, black American or Caucasians. Okay, let's move back to Mr. P. Mr. P, today we're discussing fibro. Why do we have fibro growing within?
The causes of fibroids is unknown, really. Scientifically, it's unknown, but there are a whole lot of research that have been carried on that give you some fact on the causes of fibroid. One research that was done that it gave us some basis of it having some genetic factors. That is, at the level of the chromosome, you have some level of alteration in chromosome number 6 and number 7. And those group of people, they will pass that flat jar or deuterated chromosome to their offspring. Another study talk about the uterine muscle itself, which is referred to as the myometron. You have some somatic changes or some mutation that will change the architecture of the uterus. But the most recent research, of which every scientific research now alluding to, is the hormonal factors that have to do with your estrogen level. So estrogen plays a very important role in somebody coming down with uterine fibroid, because the growth of a cell is estrogen dependent. So that has to do with the causes of uterine fibroid. So if your estrogen level is increased, if you are exposed to estrogen, or if you yearly exposure or continual exposure to estrogen will lead a female to have uterine fibroids.
So Mandela, in Liberia, we're talking about uterine fibroids in Liberia. You think what causes this in our country?
Well, there are actually a lot of causes. Before coming on the show, I was actually looking at another aspect that has to do with this family planning issue. So, most people go for family planning without proper education. And the thing about it is that, like my senior colleague said, increasing estrogen level pre-expose the woman to getting uterine fibroid. So imagine this lady didn't have much education, and then she just walked in and she said she wants family planning without knowing which one she wants, and she goes for family planning that has to do with only estrogen being provided in that particular family planning. So definitely that lady is kind of like pre-exposed to her getting fibroids in the end, or uterine fibroids in the end.
Okay, my only reason of bringing this question is that I got some form of information from a magazine article where someone has a suggestion that diet could have played a main role in the development of fiber. What's your comment on that?
And that is true. You see, in Liberia, we don't do balanced diet because you see, they think about the vitamin D. It actually plays a major role when it comes to that. So, and we only get those by means of fruits and vegetables as well. So, if you're only doing carbohydrate, definitely you're going to be pre-exposed to getting the uterine fibroid as a female.
Okay, thank you so much. So let us move back to Mr. P. Mr. P, The other issue here is that women who have fewer children are more likely to have fibroid. Is that correct?
Yeah, relatively it's correct, because if you look at the risk factor of
And
fibroid,
why?
yeah, if you look at the risk factor of fibroids, one of the major one is nulliparity, or women who have not had children or have less children. So if you have not had children, meaning that from your reproductive age beginning, you are being exposed to estrogen. So continual exposure to estrogen, and we are telling you that this growth we are discussing is estrogen dependent, will cause you to come down with fibroids. So those women who have not had children, continuously they are exposed to fibroid. And those who are having children, there will be a estrogen breakthrough during their time of pregnancy. So that limits their chances of coming down with fibroids.
Okay, if you are listening to us today on the discussion, we are discussing uterine fibroids. And if you want to be part of the discussions to ask our guest panelists all of the questions you want to know about uterine fibroids, you can call our number 0770-107-107, 0886-107-107. If you're outside Liberia and you want to be part of this all unique discussion, you can also call our WhatsApp number +231-880-571-223. That's our WhatsApp number. You can also call and be part of the show. So keep your call coming in. The phone line are open. Keep groomed to your radio and keep all of the necessary call coming in. If you are a fibroid patient, or you were diagnosed of fibroid, or you went through some kind of surgery because of fibroid, you can also call and share your experience with us. How do you feel when you are in that dilemma, or when you are in that position? So the lines are open: 0770-107-107, 0886-107-107. So call and ask all of your questions you want to know about uterine fibroids. Okay, let us move back to you, Mandela, while we open our phone line and waiting our callers to call. So we keep the ball rolling. Let's talk something about diagnosis. How can we diagnose uterine fibroid, and how do one know that they have fibroids?
So like I mentioned earlier, it is common and most people don't know because basically there are no signs and symptoms in the early stage. But the best way to diagnose fibroid, even if it is in the asymptomatic stage or even symptomatic stage, is by imaging. So you have your doctor requesting for ultrasound, which is one best way that you can be able to diagnose it. Is that easy on imaging?
Okay, and we're talking about fibroid. Mr. P, can you just take us through the various type or kinds of fibroids?
Basically, we have 3 different fibroids based on location.
Okay.
So you have the uterus muscle. There are fibroids that will be within the uterine muscle, which we call the intramural fibroids. And that accounts for 75% of the fibroids that women normally have. So the other step has to do with so now you have the intramural. The intramural fibroid may extend outward or inward. If it extends outward, it will be going towards the peritoneal cavity. So we call it peritoneal fibroid or subserous fibroids. And there are other fibroids that will grow beneath the cavity, that is the endometrium, the inside of the uterus. That we refer to as submucosal or subserous fibroids.
Okay.
So these are the type of fibroid we have. So basically there are 3 types of fibroids.
Okay, thank you so much. If you are listening to us, the numbers to call and be part of the discussion is 0770-107-107, 0886-107-107. Keep your calls coming in and keep your message coming in also. Thank you so much for that vivid discussion and telling us about the various type or kinds of fibroids that we have. Okay, let us move to Mandela. Mandela, the other point was around if fibroids present in younger women, they tend to be a bit more aggressive and cause more problems. Is that any truth to that?
The truth about it is that once there's fibroid, once the young lady has uterine fibroid, there are a lot of changes that go about in the body. So you see, the thing about estrogen as a whole, it plays an important role even in the thing that has to do with mood as well. So once there is increased mood changes as well, that's why you'll notice that even the female will tend to have decreased sexual appetite as well because of increasing estrogen level.
Okay, thank you so much. The phone line is open 0770-107-107-0886-107-107. Thank you so much for joining us. That is Stephanie. Thank you for watching. If you are watching us on Facebook, you can also help us share our video. Keep sharing the podcast. Maybe through sharing it, someone may watch it and they may be safe from certain health problem. So you never know. Ever good deeds have a greater reward. So keep sharing our posts, keep sharing our live videos, keep your comments and all of your calls coming through. Okay, Mr. Bay, we talking about fibroids. Specifically, what are some signs and symptoms of fibroids?
Well, when it comes to signs and symptoms of fibroids, for simplicity, we will divide the signs and symptoms into two different categories. That is the early sign of fibroids and the late sign of fibroids. So for the early sign of fibroids, though we said some are asymptomatic, meaning that they don't have any symptom, those of them that are going to be symptomatic, they will experience heavy bleeding that is associated with severe pain, severe abdominal pain, meaning during their menses. They will also have this prolonged menstruation daytime, meaning that the normal menstruation days, like from 4 days up to 7 days, the highest. So they will go above a week, which will be greater than 7 days. Another aspect have to do with doing sexual intercourse. Some will experience bleeding on sexual intercourse. So when they're having sex, they will have this sort of bleeding, and that will interfere with the pleasure of sex. Another group will have they will have lower abdominal pain. Other people will have pressure within the abdomen, that within the stomach, because of the presence of the foreign material called non-fibrous. For the late stage, as you know, this is a slow growing growth. It takes about 3 to 5 years before you start to actually appreciate that there is something other than a uterus in the pelvic cavity. So as time goes by, you see some of them, the fibroid may grow and interfere with space competition with the bowel in the abdominal cavity. So some of them will suffer from constipation. They will tell you that I'm not going to the bathroom as usual. Some will have pressure that is called pressure, that is, they will tell you that, oh yes, I'm feeling some heaviness in my pelvic. Some will say their stomach is getting bigger than usual. And some will come to you and tell you they are getting dizzy because fibroids, from the early onset, I told you that there is heavy bleeding. They will get dizzy and other things like that. All of those factors now, or signs and symptoms presenting to you, will encourage you to think about fibroid, taking into consideration the woman's reproductive age of 30 to 45. Most often you have to correct fibroids.
Okay, Medela, can you just take us through some complications?
Yeah, so there are actually a lot of complications when for uterine fibroid, but I'd just like to talk about 2 of them. And those are actually things that we see common. One has to do with fertility. That is where the woman can't get pregnant. She'll have everything that she can do, but she can't get pregnant. And then the other one has to do with recurrent pregnancy loss. So she gets pregnant, but every time she has miscarriage, so to speak, she has miscarriage or she has abortion, all because estrogen is high and progesterone is low. Because progesterone in itself is the one that is there to maintain the pregnancy. Because estrogen is high, progesterone cannot be high as well. So every time she gets pregnant, she'll have to lose that pregnancy and something like that. And even infertility, like I said, so the womb, it is not conducive. So it has different mass on it. So it has mass or swelling as a whole on it. You know, the sperm do not have the way to pass through to go up to the fallopian tube for the woman to get pregnant. So because of that, definitely she can't get pregnant. It will cause infertility.
Okay, thank you so much. So, Mr. Pei, how can fibroids be treated?
Well, the treatment of fibroids is it's controversial when it comes to treatment of fibroids, depending on the type of fibroid you are treating. So we told you that there are some fibroids that are asymptomatic, they are not causing any problem for the woman. So fibroid of such, you need get to know about it when you are doing other imaging or physical examination, checking the woman, you get to know it. But those that have symptoms, preferably the best thing to do is surgery. But the issue of surgery is the decision making has to do with if the woman is wanting to still have children or she is not wanting to have children. So sometimes people will go in and take the masses up, and the mass that is there, they will take the mass out and do a repair. Other people will give some medication to shrink the mass or to shrink the growth. That's how we manage fibers.
Okay, so how can, because I asked this question first, but I don't know, how can women know that they have fibers? How can you detect that you have fibers?
Most of the time, they will not actually know that they have fibers, but you will have with the sign and symptom we just discussed. It is an abnormal situation for a woman to have menstruation to go for week plus. It is an abnormal situation for a woman to have menstruation that she will change pad 6 to 8 times a day. It is a normal situation for the woman to have sexual intercourse and start bleeding. So all of those explanations will precipitate their movement or their either taking care to the hospital to ask what really is happening. And if they get there, you as a doctor, through your examination and your imaging, as my colleague just said, you will be able to know, oh, this is fibrosis, and you inform the patient about fibrosis. So basically, they may not be aware of it being fibrosis, but they will just consider.
Good morning, your name and where are you calling from?
My name is Ibrahim. I'm calling from Locum de Red right now.
Welcome to Health Talk. Welcome to Health Talk.
Yeah. Hello.
Hello, we're discussing uterine fibroids. Welcome to Health Talk. You are live.
I'm not getting there.
Please change your location and call back. Yes, let's continue.
So as I was saying, with all of the signs and symptoms patient will present with, it is the doctor that actually going to tell the patient this is your condition after physical examination, after imaging, to confirm that actually this was a fibroid. Because some other condition will mimic with heavy bleeding, bleeding on sex, spotting, that is male bleeding. There are other conditions that are going to present that. So after the doctor physical examination, with all the other discomfort, go through their imaging, they will come out to tell the patient that this is fibroid, then the decision can be made what to do.
Okay, thank you so much. So, Menera, we were talking about complications, and you mentioned pregnancy aspect that it will be difficult for women to get pregnant, or it can spoil pregnancy, something like that. So, can you just go in detail? Why do it have to be related to maybe termination of pregnancy?
So, like I said, there will be infertility issue. So imagine the abnormal growth on the wall of the uterus or the womb, to be more specific. So the sperm cell should have a very free will to go to the fallopian tube down to the ovary, where it will be able to fertilize the egg. Now the sperm cell can no longer travel because of the narrow spacing in the uterus. So imagine if the row was straight and somebody tell you now you cannot use that straight way, you have to pass band rule, imagine what's going to happen. And the sperm cell has a certain length of time to live for. So as it penetrates through, or as it passes way through, you know, before reaching to that egg cells, it's already dead. So definitely there's going to be an issue of infertility.
Is there any advice you have for women that are going through that, or maybe like?
Yeah, so if you're having that issue, the best thing I can tell you is to see your GYN doctor. So your GYN doctor can be able to plan for you, like my colleague said. He'll be able to tell you whether it's basically surgical, whether he can manage it by means of surgery, or he can manage it by means, maybe give you some other pills that will shrink it, depending on the location of the uterine group. Then he can be able to advise you, okay, you have children, or you can have a child, or you cannot have a child, or we'll be able to do surgery, or we'll just give you medicine, and then you can be able to go.
Good morning, your name and where are you calling from?
Yeah, hello.
Good morning, your name and where are you calling from?
Hello.
You are live.
We are getting this. Hello.
You are live. Your name and where are you calling from?
I don't even know now. Hello.
Oh my God, I don't know what's going on here today. Please change your location and call again, please. We are discussing uterine fibroids. If you want to be part of the discussions, the numbers to call is 0770 107 107 0886 107 107. If you are outside Liberia and you want to be part of this all important discussion, you can call our WhatsApp number +231 880 571 223. That's our WhatsApp number, so you can keep your calls coming in. If you can get us, just log on our Facebook page and keep all of your Google comments coming in. We're going to read it live, and we see how best our guest panelists can answer all of your comments or your questions that you have on mind. So keep them coming in. The numbers to call is 0770 107 107 0886 107 107. Keep your call coming in. I'll continue with that.
Yeah, and the other issue has to do with the pregnancy losing. So every time the woman gets pregnant, she has to lose the pregnancy. So like I said previously, estrogen and progesterone, they are two basically hormones that help, you know, in the whole thing about the taking in the uterine wall and also maintaining the pregnancy as well. So if estrogen gets high, definitely progesterone will have to drop low. And if progesterone drop low, that means the pregnancy is not going to hold.
Good morning, your name and where are you calling from?
Is it Andrew someone from Singer?
Yeah, Andrew, welcome to Health Talk.
Yeah, I want to ask you again.
Yeah, go ahead. You're live.
What are the difference between fiber and hookworm? Or the hook work the same way or not? And the second person has to do with can man handle all the female?
You said what are the difference between fibers and what?
And what hookworm?
Okay. Thank you so much. Thank you so much.
What are man can handle or only for female?
Okay, keep listening to the show and we'll discuss that briefly. So we got a call and the question was, what's the difference between fibers and hookworms? Then his second question was, can male have fibers or only female?
Okay. As from the previous discussion, we told you that fibroid is an abnormal or non-cancerous growth of a tissue, whereas he talked about hookworm is another living entity, is a parasite that live within the stomach. So they do not really have any link. One is a parasite that living in the stomach, and the other one is just abnormal cell growth or cell proliferation.
Okay, Medela, you want to come in? So the next question was, Medela, can male have fibers or only female?
Male doesn't have uterine fiber because they don't have one.
Okay, thank you so much. So keep your call coming in 0770 107 107 0886 107 107. So Medela, we were talking about the fertility issues, especially when it comes to fiber. You can just continue what you were saying.
Yeah, so I was on you know, the woman getting pregnant, she lost in the pregnancy. So I was just comparing the two, estrogen and progesterone. So if estrogen gets high, progesterone will have to drop because the two of them cannot be high at the same time. And once she gets pregnant, it is the progesterone that's supposed to hold her pregnancy until she can deliver. But imagine progesterone is low. It's like putting sand in a gari. So you have a lot of sand, definitely you'll not be able to eat that gari, you'll have to trunk it with. So that's the same way with the whole issue of pregnancy. Progesterone can no longer maintain a pregnancy because it is low. So because it is low, it will definitely have to come down. That baby will have to come down. And another thing again too that sometimes we don't take notice of is the issue of anemia in uterine fibroid. Because the lady bleeds a lot, they tend to, in some other instances, they tend to go into what we call shock. They lost a lot of blood, they get anemic, and the end result, they get into shock, and sometimes they can even lead to death as well.
Okay, thank you so much. Thank you so much. So, Mr. Pay, before we conclude, because time is fast spent, and I'm looking at the time here now, we got less than 15 to 20 minutes here. So I just want to ask these questions to the both of you. Every operation has side effect, right? Every operation has side effect and so on. So who is the candidate for hysterectomy and who is the candidate for myrectomy? So you can answer the hysterectomy, he can answer it. So both of you can divide.
Yes, the issue of being a candidate for hysterectomy, and most time is based on the surgeon decision that will be discussed with the patient. Number one, this lady has uterus fibroids, and the fibroids have taken over the entire uterus. And two, she's a person that already have children. She have children, so the important news of uterus is not significant as compared. So if you compare the risks of having the uterus and the benefit of having a uterus, the risk surpasses the benefit. So you have to discuss that with her to save her life, because the uterus are so massive. You have smaller one coming out. Even you take the bigger one there, the small one over time is going to grow again. So you have to discuss all of that, benefit against risks. Then from there, the patient have to give their own consent. Then you can do it. For those who are just like 20, they just say 30, 31, 32, and they are not having children, they are still, wanting to have children, you have to preserve their uterus at all costs. Yeah, except wherein nothing else you can do, then that can be discussed again with the patient. Because the issue of hysterectomy is a decision that even the surgeon alone cannot do. Okay. So both the patient and that of the surgeon have to decide and make that decision, so that tomorrow you can say, oh, you are the reason, and not taking into consideration the race. So that is the issue of hysterectomy.
Okay, so Menela, I don't hear from you on the myrectomy area.
So doing out of them, let me make this clear first. Doing out of them doesn't mean you can get the woman cannot get a uterine fibroid. Okay. She can still get a uterine fibroid. Because there's possibility when the doctor was, performing his or her surgery or was diagnosing that particular condition, the other small one was there that was not noticed. So there's possibility it can still grow in a long period of time. And the issue of myomectomy, which has to do with just cutting a particular portion, only that portion that is affected, removing it and allowing the patient to go ahead and all of that. We'll look at the risks involved as well. That's the reason why the GYN doctor will be able to discuss with her and see whether, okay, since this is inside the uterus, whether we can just remove it, whether it will be safe, or because this is outside of the uterus, whether we can do this procedure. So it also depends on the position of the uterine fiber as well. The GYN doctor can be able to make a decision and discuss with the client and say, okay, this one is inside the uterus and we feel this is huge, so this cannot be myomectomy, so it has to be a hysterectomy. So the decision lies between the GYN doctor and that of the patient as well.
Okay, thank you so much. Thank you so much. So, Mr. Pei, can we just hear your final statement and that of your closing, your advice to the public, especially for female?
Yes, yes. Uh, for my listening audience, as we discuss the sign and symptom of uterine fibroids, a female having heavy bleeding during their menses, they're associated with severe pain. They are having their menstruation time is exceeding a week. During sexual intercourse, they are having sex bleeding on sex. They having some pressure, pain or some pressure within their pelvic. All of those signs and symptoms, when you experience it, it's better not to wait there and be late. So you have to take the pathway of going to the hospital, see your GYN doctor to be able to help you. Because if you wait and it is too late, you will reach a point wherein your doctor have to discuss the issue of hysterectomy. Let's assume that you have not had a child. So it will be a critical decision for you and your doctor. So at the end of the day, sometimes you have to accept because of the risk. And many couples have lost their marriage because of that. So we advise all of people what has been discussed. If you experience any of that, you can get to the health facility and you'll seek care.
Okay, do you have any other things that you want to say that we didn't touch?
Well, basically, we have done everything, but one of the things we left out, it was not holistically discussed, is the issue of the risk factors. The risk factor of uterine fibroids. Yes, we said women, our prevalence is aged 30 to 45.
Sure.
That's our prevalence. So I'm aged, the lady is of age, she's in the age of 30, 35. What makes her to be candidate of uterine fibroid? That's the risk. What makes us to not be candidate of uterine fibroid is the risk. So basically, once the other say black race, that one of the race, the father of the matter, you are a female, your reproductive age, meaning age 35 to 45, and you are a black female, it's a risk. Another aspect is women who have not had children, they have this continual exposure to estrogen, because every time they have their menses, estrogen need to be produced to carry on the hormonal interplay. Another group of people that we need to look at is if you have a genetic problem, like in your gene line, you have the default in the fragile chromosome deletion or re-enrichment. That will be seen with either your mom have fibroid, either your big or the smaller sister have fibroid. There's a likelihood you're having fibroids. Another issue has to do with early menstruation. There are some children, they are going to start menstruating at the age of 9, 10, 11. So meaning that they will be exposed to estrogen early. So that continued exposure to estrogen, and the fact of the matter, the fibroids is estrogen dependent. It makes you again a candidate for fibroid. So we had a joke that said, any NUFE woman must have fibroid. That is NUFE, nulliparity, family history, early menage or menstruation will make you to have fibroids. So that's what we did not really dwell on. So being in this group that we just discussed, you have to have some level of check up with your GYN doctor to see as to whether the father or the mother that you are considered now yourself as candidate, or if you have a greater risk, you have to visit your GYN doctor periodically, either once in a year, to check as to whether you are having some abnormal growth in your uterus.
Okay, thank you so much. Thank you so much. So Mandela, even though we have limited time now, but in my introduction, I mentioned 70 to, according to the National Institute of Health, they said 70 to 80% of women would have experienced fibroid at the age of 50. What do you have to say about that?
Normally, at the age of 50 is where you start to experience some hormonal changes. And so it is believed that you have more estrogen level at that particular time. Because the lady is now moving off the calendar of born children. So even though she having her small little messes and thing, where the uterus starts to prepare itself, but there will still be more increase.
That will also be around menopause.
Yes, sure. So you have estrogen level playing in, and that could also, not forgetting the issue of vitamin D as well, because they also lack those vitamins as you start to get older. You lack those vitamins as well, and maybe at the age of 50 also the woman tend to be somehow obese, because even obesity has something to do with the estrogen level as well. So all of those things come into play, can actually predispose someone even at the age of 50.
So in your previous discussion, you mentioned about diet. Looking at Liberia, what advice do you have for women, especially that are done with this or may like they have it? What advice do you have for them when it comes to diet and that of exercise, or those activities of daily living for women?
And thank you for the question. This is something that most of the medical practitioners will tell you. You know what, you got to have a balanced diet. But without looking at the economic situation within the country. So imagine this person only have meal to eat one time. And then you tell the person you gotta mix fruits and vegetables, and stuff like that. It's like, which planet are you coming from? Oh, like you're not living in Liberia. So I mean, even though you can't get the fruits and vegetables, but one cardinal thing is exercise. So you don't want to be obese. You gotta take your exercise as often as possible, to always keep fit. That can help you as well.
Yeah, but some of these fruit are also cheap in Liberia, like the guava. Guava is cheap in Liberia, so when eating guava, I think that can also help, like the cabbage. Cabbage is not that expensive.
Agreed.
Vegetable also.
Agreed, it might be cheaper.
Enough water, drink enough water, it can help.
Yeah, well, it's really less cheaper. I agree, those things might be cheaper, but looking at how many persons can afford over $250 per day to eat. Imagine this person who only has $250 to eat.
Are they drinking enough water?
So yeah, so those are the situations.
Thank you so much. Thank you so
And
much.
one thing is that the issue of family planning too is something that we should consider. So for all of our young ladies in a reproductive age that want to do family planning, it's advisable that you talk to the social counselor or family planning counselor to be able to help you out, because not just any family planning you can take. If you make a mistake and you take the estrogen part of it, definitely you head into disaster.
Oh my gosh. Okay, thank you so much, guys. It has been just a wonderful discussion. Thank you so much for your time. And to our viewers and listeners out there, thank you so much for being with us. Thank you for your call. Keep your messages coming in. We encourage you to send more messages. Keep your messages coming in on our Facebook page. Please do join us next week, Thursday, same studio, same time, on another fibroid topic that we will be discussing here, because we deal with health issues, especially issues that are affecting us in our respective community. We want to take this time to thank the Hot FM family, to also thank Honorable DJ Blue for allotting us time in studio to always discuss issues that are affecting us in our respective environment. Thank you so much for being with us. Thank you for your call. Keep them coming in. Please keep following our Facebook page, Mama Alume Health Talk platform. Don't forget to join on next week Thursday for another edition.